coming back to you. We've done a YouTube back in the day in regards to trigger point massage. We got a lot of interest in that, and I wanted to cover a little bit more with you on that today. The thing we're going to cover with you today is something that a lot of Americans deal with, and that is headaches. And specifically headaches due to tension or physical stress, due to job, work, accidents, sleeping wrong, you name it. We're going to cover some basic tips on how to help that out and see if we can maybe help you at home as well. So, first thing we're going to do is have the person that you're working on sit in a chair. Sitting is going to be the easiest way to do this. There are some rules before we do this. Number one, make sure that when you apply pressure, you apply enough pressure so at least the nail bed of your thumb becomes somewhat white. Okay? Second rule, make sure you don't push on the bones. Just push on the muscles. Number three, make sure that when you're pushing, make sure that the person that's giving the massage is listening to the person that's receiving the massage. The person receiving the massage actually is the teacher. They're telling you how much pressure to push and where to push it. Make sure when you push on the point, if you apply pressure on that point and it travels somewhere, make sure to hold on that point until the point lessens or where it refers to lessens or goes away. Because we want to make sure we get that under control. That's going to be the epicenter or the key spot of the muscle that we want to focus on. Now, if I just apply pressure on that point and there's nothing that radiates from that point somewhere else to the body, that's just called a tight muscle. You still want to apply pressure on that muscle, but only for 8 to 10 seconds. All right, those are our main objectives in this job. Now, making sure too, when we get done, drink a glass of water, maybe 2 or 3 if you need to, especially if you don't drink a lot of water, because toxins will come out of that muscle. And that will make you maybe tired, lethargic, have a headache, make you a little nauseous. And that's normal, but we want to make sure you get water to make sure we're good in that area. All right, so starting with this, what we're going to do is have the person receiving the massage, we're just going to kind of take their head, bend it back and forth. And by doing that, I can locate the back of the scalp or the back of the head right here. I'm going to use my thumb and forefinger. You can use your thumb and middle finger if you'd like. And I'm going to apply it right on there's little knobs, almost feels like little knobs on the back of your head right here. I'm going to apply pressure there. We're going to do it for 8 to 10 seconds. Unless it radiates somewhere else in the body, then I'm going to hold it till it lessens or goes away. I'm also going to be using my other hand to apply pressure on the forehead, so when I apply pressure, the head does not go down. Is that too much pressure?
No.
Now, the person receiving the massage will tell me if that's too much or too little. So far, we're doing good. I'm going to move a 1/2 inch from the previous spot, applying pressure. Is that too much?
No.
Is that radiating pain anywhere else in the body?
No.
So we're not on a trigger point. We're going to go another 1/2 inch from the previous spot. And Mandy, you tell me if that is too much or too little. And looks like we're doing a good job. So we're going to continue down until we get to the shoulders, where the shoulders meet the neck. And is that too much or too little? About right?
That's about right.
Perfect. Now, while I'm doing that, I'm also making sure that the spine is right here. I'm not pushing on the spine. I'm going to go out about a 1/2 inch to 1 inch out from the spine into a good area where I can apply pressure on the neck. Good. Now, what I'm going to do too is I'm going to work with these muscles right along the top shelf of the shoulders called the trapezius muscles. I'm just going to apply pressure with my thumb, hands gripped around the shoulder and applying pressure straight down through my arms with my body weight. As you can see, my thumbs are slightly white, and I'm getting enough pressure. And Mandy is telling me if it's too much or too little.
That's good.
Is that good?
Mm-hmm.
Now I'm going to move a 1/2 inch from that previous spot, and I can feel a good one right there. Is that going anywhere in your body, Mandy?
Yes, down my arms.
So that's called a trigger point. I'm going to hold on to that point, especially on the right side, until it lessens or goes away. And I'll know that by Mandy telling me that it's going away.
It's going away.
All right, so now we're going to move another 1/2 inch to the other spot. And one more. These are not as sensitive, I can tell. And we're going to stop right before we get to the shoulder bones right here. Okay? Now, this simple tool, starting from the base of the skull, working down at the shoulders, from the shoulders out to the shoulder joint, is very effective in relaxing the muscles that radiate pain to the head, which can cause headaches during a long day. Remember, when you're sitting, to keep your shoulders back, head back. Now, unfortunately, a lot of us, when we're sitting all day, we tend to round forward, and we don't want that to happen. So when that happens, these muscles get tight, radiates pain to the forehead, and creates headaches. Thank you for listening to us today about trigger point massage. We look forward to hearing from you, or would like to join us on our website at holmbergwellnessgroup.com. Thank you.